Second white coat. Subscribe and like. Let's learn medicine together.
You ever get that weird feeling, a patch of skin on your thigh that's kind of numb, maybe tingly, and you have no idea why? It's actually a super common thing. But what if I told you that simple symptom could be the main clue in a really interesting medical mystery? Well, today we're going to put on our detective hats and solve one of those exact cases.
All right, so let's open the case file. Our patient is a 55-year-old guy, and he's pretty worried about this strange sensation in his thigh. It's not just annoying, it's confusing. And believe it or not, the key to solving this whole puzzle lies in what he's been doing for the last 48 hours.
So where does our story begin? It starts with a long drive. We're talking an 8-hour car ride. Our guy was kind of crammed in the back seat for the whole trip, and as it turns out, that's exactly when the first clue in our investigation decided to show up.
So during that endless ride, he starts to feel something weird. A strange burning numbness starts to creep over the side of his right thigh. And this wasn't your typical muscle cramp, This was something different. And it definitely did not go away when the trip was over.
And here it is, our first huge clue. The numbness, it's only in one very specific spot, right on his upper outer thigh. It's like a distinct patch of skin. It doesn't shoot down his whole leg. It doesn't wrap around to his back. This super specific location, it's absolutely critical.
Okay, so we've got the patient's story. Now it's time for the physical exam. This is where we, as the detectives, get to gather the hard evidence. We need this to start connecting the dots and hopefully crack this case.
All right, let's take a look at the evidence file. We've got our 55-year-old male. Chief complaint, that burning pain and numbness on his right lateral thigh. The triggers are pretty clear, that 8-hour car ride, and he also mentioned that even wearing a tight belt makes a flare-up. We've also got his history noted here, type 2 diabetes, a high BMI, but really the key finding, the one we keep coming back to, is that isolated patch of numbness.
Now this is where things get really interesting. The exam results are, well, they're kind of surprising. We test his muscle strength, it's perfect, 5 out of 5. We check his reflexes, totally normal. We even do that straight leg raise test, to check for a pinched nerve in his back, negative. This tells us so much, because it means we can start ruling out some of the most common culprits for these kinds of symptoms.
So, this is the crucial clue, right here. He has a very real sensory problem, that burning and numbness. But his motor system, the nerves that actually control his muscles, totally fine. That's a huge tell. It means the problem almost certainly isn't coming from his spine. It's got to be somewhere else entirely.
Okay, so in any investigation like this, you've got your usual suspects. And when someone has leg pain and numbness, the number one suspect is almost always sciatica. A pinched nerve in the back. So let's take the evidence we've gathered and see if it points to our prime suspect.
And just look at this comparison. Our prime suspect is innocent. Classic sciatica causes pain shooting down the back of the leg. It often comes with muscle weakness or changes in your reflexes. But our patient, his symptoms are on the side of his thigh, and his strength and reflexes are perfect. The evidence just doesn't line up, so we can officially rule out sciatica. Case closed on that one.
All right, so we've ruled out the most common cause. That means our investigation takes a sharp turn. We have to look for a different explanation. The answer isn't buried deep in his spine, it's hiding somewhere else.
So the big question is, if the problem isn't coming from the spine, where on earth is it coming from? If it's not a big nerve getting pinched in his back, what else could it possibly be?
And the clue, the real key to solving this whole thing, has been staring us in the face the entire time. It's the location, the exact location of the numbness. It's not just a hint, it's practically a treasure map pointing us directly to the culprit.
And here it is. This is our culprit, the lateral femoral cutaneous nerve. Now, what's so special about this nerve? Well, it's pretty unique because it only controls sensation. It has nothing to do with movement. And look at its path. It runs from the spine out through the pelvis, and then it has to squeeze under this tight little band in the groin called the inguinal ligament. And that exact spot, that's our crime scene. That's where it's getting pinched.
And just like that, case closed. The cause of our patient's mysterious numb thigh wasn't some complex spinal issue at all. It was a classic open and shut case of a nerve getting trapped right at the hip.
Now, the official name for this condition sounds really complicated. Meralgia paresthetica, but trust me, it's not. If you break it down, meralgia is just Greek for thigh pain, and paresthetica means burning or tingling. So the fancy medical name literally just describes the symptoms. Thigh pain with burning and tingling. Simple, right?
Okay, so now let's put all the clues together and see how this happened. First, that long car ride forced his hip to be bent for hours on end. Second, the external pressure from his tight belt, plus his weight, added even more pressure right on top of that inguinal ligament. And third, those two things combined to squeeze that purely sensory nerve. And that is why he had all the burning and numbness, but zero muscle weakness. It all makes perfect sense now.
So, what's the big takeaway from our little investigation here? Well, the good news is that while this condition is super common and definitely annoying, it's almost never dangerous. And now we have a really clear set of clues that can help us spot meralgia paresthetica from a mile away.
So here's the pattern you need to lock away in your memory banks. If you've got that burning, tingling feeling on the front or side of your thigh, but your strength and reflexes are totally fine, and it gets worse when you wear a tight belt or sit for a long time, you might just be looking at a classic case of meralgia paresthetica.
You know, this case is a great reminder that the most obvious answer isn't always the right one. Sometimes these small specific clues point to a very specific diagnosis. For this condition, the treatment is usually simple stuff like wearing looser clothing. But it makes you think, right? If you have some strange ache or pain that just won't go away, don't just brush it off. It could be a clue in your own medical mystery, and it's always worth getting it checked out. What other common aches and pains might not be what they seem?